Welcome to the Paul Chandler Show, everyone. I'm your host, Paul Chandler. In today's episode, we're going to be looking at the massive influx of new codes that we have for substance abuse categories in the ICD-10-CM book for 2021. So during this presentation, remember you can always come back and watch the videos after we're live on YouTube. That's the youtube.com/The Paul Chandler Show. Or visit us also on our website, thepaulchandlershow.com, because we'll have lots of information, especially with all the different codes that are increasing for substance abuse. So stay tuned and we'll be right back. Welcome back to the show, everyone. And today we're going to be looking at coding substance abuse in 2021. And the reason behind that is this year, the ICD-10-CM had a drastic amount of changes because they added a lot of new codes with the word withdrawals and better clarifying that. Because we do have 21 codes that were added for abuse and abuse with withdrawal. And the main thing is that as far as the coding, it is supposed to be known that it can occur when individuals using substances regularly suddenly stop taking them. And individuals taking prescribed medication daily, exactly as directed, who are psychologically addicted to the substance, but who do not have the behavioral elements required for a diagnosis of substance dependence, and for individuals who abuse substances regularly. And now, to be able to have that, though, that does require the diagnosis of substance abuse. And those individuals lack the loss of control required for a diagnosis of substance dependence. And here are the 21 codes that were added in the F10 through the F19 categories dealing with withdrawal. And you can freeze frame this episode if you like when it's available on demand, just right after our live production here. Now you can see, though, that the categories that involve the different new withdrawal codes, we have dealing with the F10s, the alcohol abuse, and the F11s, opioid abuse, F12 with cannabis abuse, F13s with the sedative abuse, F14s with cocaine abuse, F15 with other stimulant abuse, and the F19 categories with other psychoactive substance abuse. So all these categories here included the new types of withdrawals as far as the coding. Now in the mental behavioral health world, they have what's called DSM-5, and they use the same codes. However, though, the verbiage is a little bit different. Because in ICD-10, we distinguish between alcohol and substance abuse, use, and dependence. The new alphabetical index, we do have the different tabular listings as well. And the ICD-10-CM book also uses an assistance with the DSM-5. It provides the clinical terminology for alcohol and substance for disorders that help better align the terms between those two coding manuals. And DSM-5 uses disorders are categorized by the level of severity and remission status. And here we have the next part, right here, differentiating between how we use the descriptions in ICD-10-CM and the DSM-5 description. So in ICD-10-CM, we use the word use, and the DSM-5 manual for the clinical providers, instead of use, they have the verbiage of use without use disorder. We use the word abuse in ICD-10-CM, while DSM-5 uses mild use disorder. We use the word dependence in ICD-10-CM, while DSM-5 uses the phrase moderate or severe use disorder. And ICD-10-CM description of dependence in remission is translated into the DSM-5 description as moderate or severe use disorder in early remission or in sustained remission. So as you can see here, ICD-10-CM and DSM-5 both have the same number of different descriptions. We just use a little bit different verbiage between the two manuals. And now we're just going to do a bit of clarification that will help us with the codes in the F10 through F19 categories, and looking at the Chapter 5, mental, behavioral, and neuroenvironmental disorders for the ICD-10-CM guidelines. Part B, number 1, for in remission, gives us the guidance of selection of codes for in remission for categories F10 through F19, mental and behavioral disorders due to psychoactive substance use. And these are in the categories F10 through F19 with a 0.11 or 0.21 for the 4th and 5th code in the characters. That the use of remission requires the provider's clinical judgment. The appropriate codes for in remission are assigned only as a basis of provider documentation, unless otherwise instructed by the classification. Mild substance use disorders in early or sustained remission are classified to the appropriate codes for substance abuse in remission, and moderate or severe substance use disorders in early or sustained remission are classified to the appropriate codes for substance dependence in remission. And in the Chapter 5, Part B, number 2 guidelines for psychoactive substance use, abuse, and dependence. Now, when a provider's documentation refers to use, abuse, or dependence of the same substance, such as either alcohol, opiates, or cannabis, only one code should be assigned to identify the pattern of use based on the following hierarchy. If both use and abuse are documented, assign only the code for abuse. If abuse and dependence are documented, assign only the code for dependence. If use, abuse, and dependence are all documented, assign only the code for dependence. And if both use and dependence are documented, assign only the code for dependence. Mild substance use disorders in early or sustained remission are classified to the appropriate codes for substance abuse in remission, and moderate or severe substance use disorders in early or sustained remission are classified to the appropriate codes for substance dependence in remission. And here's a little chart that you can use to help you with the coding of the different descriptions. And so me just going up the hierarchy of it, dependence is on top, abuse is in the middle, and use is at the bottom. So whenever you have multiple levels of description in your documentation, whichever one is more towards the top, that's the one that you use. And one more part with the guidelines. For psychoactive substance use unspecified, in Chapter 5 of the guidelines, Part B, number 3. As with all other unspecified diagnosis, the codes for unspecified psychoactive substance use, and these are all of the categories where the 4th character is the number 9, should only be assigned based on provider documentation and when they meet the definition of a reportable diagnosis. These codes are to be used only when the psychoactive substance use is associated with a physical disorder included in Chapter 5, or mental or behavioral disorder, and such a relationship is documented by the provider. Now, to start wrapping up this education on the new withdrawal codes, here on the left we have the different categories for F10 through F19. They're F10, alcohol, F11, opioid, F12, cannabis, F13, sedative, hypnotic, or anticholactic, F14, cocaine, F15, other stimulant, F16, hallucinogen, F17, nicotine, F18 inhalant, and F19 other psychoactive. And because all of the F10 through F19s have the same format, only showing you here the F10, because this is what I use the phrase is in carbon copied. And looking at the codes themselves, we can see here by representation of the black dots, the new codes for 2021. So we have the F10.13, which goes more breakdown into F10.130, 131, 132, and 139 for alcohol abuse with withdrawal, and regarding if it is uncomplicated, delirium, with perceptual disturbance, or unspecified. And breaking down the different 4 character categories, F10.1 is alcohol abuse, so that'll be the same regarding the other categories listed on the left, the F10 through F19. And we have the F10.2 for alcohol dependence. And it breaks it down, are we dealing with uncomplications, in remission, with intoxication, with withdrawal, with alcohol-induced mood disorder, with psychotic disorder, with persisting amnesic disorder, with persistent dementia, or with other alcohol-induced disorders, or unspecified. And the F10.9s for the alcohol use unspecified. While we have, again, going on with the new codes, the F10.93 carries on to 0.930, 0.931, 0.932, and 0.939. Going with that unspecified with withdrawal, again, just like how we had before in the beginning of this category, the F10.930 with uncomplicated, 0.931, delirium, 0.932, with perpetual disturbance, and 0.939, unspecified. And that's a wrap from all of us here from the cast and crew of the Paul Chandler Show. We do thank you for watching. Live long, do good, and prosper.